Guys, we will I will take the last three questions and then we move on. Someone is asking for me to do hemato-oncology, do you have to do IMED first? And how many years of hemato-oncology? Yes, you have to do IMED first because hemato-oncology is a fellowship program. Uh, and Doc, the fellowship program depends on a lot of factors, is it? It's a 2-year program that depends on a lot of external factors, yeah? If I remember correctly.
Yes, it does.
Okay, okay. Okay, no problem. How much does the entire program cost for self-sponsor? Um, Doc, could you like not calculate it, but just say what the first year, second year, third year was? I don't have it offered. Not,
Um,
are you up?
there's a table when you go to the
Yes.
page for you and they actually share how much it is. So year one is 382,000. Year two is 332,000. And year three is 362,000. So total you'd be looking about at 1,076,000. Of course, with overhead costs. Remember, we talked about research. So 1 million plus
And it's 1 million spread over 3 years, so
over 3 years.
it's not
Yeah.
like what, yeah, it's not like
Mm.
1 million you're going to pay one, and then in second year,
Mm.
like Doctor said, and third year you're on. Basically, no one is going to follow you around with a torch saying that you need to pay your school fees.
And when you
You
start the
too.
program, you just pay the initial 60 and you have some time to gather yourself before the exam.
The amount covers everything up to exams. Yes, yes. The amount covers everything up to exams. Okay. I think that's it. Doc, thank you so much for this great presentation. Uh, and We appreciate your time. I know you've taken some time off from all that you're doing. The audience appreciate that you've given this talk. I think their eyes and minds are ever open to this presentation, and they go and apply for this program knowing what is waiting for them. Is IMED 3 years or 4 years? IMED is 3 years, and it can go longer depending on how long you take with your thesis. But yes, on paper, IMED is 3 years, and people have finished 3 years. Uh, so the two exam periods, that February and August. So you can do your exams either in February or August. So depending on what time you finish, and that's the beauty about it. If you finish your book, the thesis starts from first year, end of first year. You start thinking about it, and it's not. It's a in IMED, the thesis is a humbling experience, and yes, you it develops you as a researcher, as a physician, and as an individual. So this is mambo yote in internal medicine. Doc, am I right about that? Hmm.
You will learn a lot about yourself. Yeah, but but
Yes,
but it's growth. So it's yeah.
yes, yeah. So that's it, Doc. Asante sana. Thank you
Thank
so
you.
much. Yes, thank you for coming through. So the next presentation is initially we wanted to go to Dr. Ciele, but I'm a presenter from Mo is in the house, so I think we'll give that the priority for now. And we'd like to welcome Dr. Fauna Njoroge, who is a senior registrar in internal medicine at the University of the Mo University. And yes, and we can do that in pediatrics. Daktari, karibu sana. Your slides are visible and they're on slideshow.
Thank you. Thank you for having me. Let me just mute my background. Yeah, so this is a wonderful initiative. Dr. Aidan and the team, I think we should have had this in our joining postgrad. I think it gives a lot of insight. While we may not be able to answer all the questions, I think it's important just to know what you're getting into. And I'll echo what Dr. Julian mentioned, that an MEd is not purely about you being in class or you being in the wards. It's also, you're at a point in life when you're an adult, so you also kind of want to have a normal life. So I'll be talking about the program in Moi University, the MEd program to be specific. So I'll take you through the introduction, just talk about it. Then our program structure, how our admission and fees are, the pros, the cons, and then I will close. So basically, the internal medicine program in Moi University is a 3-year program. And it has an academic part, which is the research part, which even here in Moi University, the reason why people will take a longer time is because of their thesis. And then we have the ward work. But it's basically on paper a 3-year program. When we talk about the requirements of what is required to join the program, ideally is to have completed an MBCHB and to have completed your internship and then to have done an entry exam, for which if you check the Moi University application portal, it's usually open earlier in the year to around May, where you apply, you're called for interviews. For Moi University, we don't have a face-to-face interviews. It's usually an MCQ, and then you can have an online interview. However, I think currently they're trying to change it towards having an MCQ and then now having a face-to-face interview. The intake is usually in September as well. For the application, the amount that is required is 2,000 shillings, and that's on the portal. So it's a 3-year program, but classified as part 1 and a part 2. And the part 1, the first 3 months is usually purely for courses that help you build on your research. So we start with epidemiology, which we do for a month. At this time, you're not in the wards at all. So you're basically having classes every day with the epidemiologists for a month. And then after that, we do biostatistics for a month. And then we proceed to research methodology for a month. During this period, you're expected to be developing a concept that you will present to the research methodologist, so that as you get into the ward, you're focusing purely on your patients and now just presenting your concept presentation. Also for part 1, there's the basic physiology classes and just basic systemic classes, understanding the pathophysiology of diseases. At this time also, as you're developing your concept, here we present it to the department first, and then we send, once the department approves for you to continue with your concept, then you're able to send it to the ethics committee for approval. So that happens in part 1. And for Moi University, for you to get into part 2 and the criteria is for you to have ethics approval from IREC. So that is usually how you delineate part 1 and part 2. What that means is you could be in part 1 for as long as 2 years if you have not come up with a concept, presented it to IREC, and you've gotten your approval. If you do that within 1 year, then your part 1 is 1 year. So it's not really that part 1 is a 1-year thing and then part 2 is a 2-year thing. Part 1, the end of part 1 is at the point where you have presented your concept to IREC and it has been approved. And then you're able to sit your final exam for part 1. Once you get into part 2A, we do our external rotations, which is dermatology, ICU, psychiatry, radiology, hemato-oncology, and infectious disease. So we do that for 6 months. That is your part 2A. As you're proceeding to your electives, Moi University has an AMPATH consortium that gives us the opportunity to do our electives in partner hospitals, that's Duke and Indiana and Brown. So after you finish your electives, you're in part 2B. At this time, you're defending your thesis after your data collection, and then you're ready to complete your exam. Well, it looks very easy here. It looks very easy to look at it on paper. It's a whole journey, and the journey is usually mostly with the getting your concept approved, collecting your data, and then doing a departmental defense, and eventually doing a school defense. So how does a day-to-day look like? It's usually very predictable. We have morning classes almost every day, and depending on whether this is a nephrology class, a hepatology class, our classes run from around 7 to 9, so that we're in the wards at 9. So there's a regularity. For Wednesday, we always have mini rounds or concept presentations. And then on Thursday, we have our journal clubs where we discuss the latest papers, and that is usually done by the students. After that, at 9, we get into the ward rounds, and then we also run clinics concurrently with the ward rounds. So most of our days run between 7 to around 1 p.m. In the afternoon, most afternoons are light. You're either sorting out things in the wards that need to be sorted out, or you're having your group discussions. So what's usually heavy is the morning hours. The afternoons are usually quite light. So what are the pros of being in an MEd in Moi University? It's student-based learning. So that means it's a pro and a con in a sense that you actually have to push yourself to get the consultants on board for you to have lectures. So most of the times we are the ones who conduct the lectures, and then the consultants are able to critique and to add input. I appreciate that there is support from phlebotomy. So what that means is we're able to focus on clinical decisions. We are not the ones who usually collect our lab works. We have porters who are able to transfer patients between radiology departments or any other place they need to be. So I think that gives us room to be able to focus on patients in the morning and then have an easy afternoon. The AMPATH Consortium also gives us some opportunities for research, especially with HIV care or infectious disease, and that has helped us kind of have a mentorship program with the infectious disease team. There's also a lot of flexibility. Same thing as in University of Nairobi, we only do calls in part 1, but in part 2, we usually don't have night calls, we only have day calls. So that gives us a lot of flexibility to be able to focus on work-life balance. I appreciate that, having worked in Nairobi, I appreciate Eldoret in the sense that it's rather slow paced. So you're able to probably do whatever you need to do in the morning. If you like to go to the gym, if you like to run, do that, and then get to the wards at around 9, and then have a slow day in a sense. So I appreciate that it's very traffic light, and generally a green and a serene place to be. And then we have a doctor's lounge. With a growing number of self-sponsored registrars, we appreciate that the doctor's lounge offers basically breakfast, lunch, supper, tea break, all those kinds of things, and it allows us to have a community of registrars. What you notice is in Moi University, a lot of us know each other, spend a lot of time together, sit in the doctor's lounge and talk, and I think that's one of the greatest blessings, I would say, for Moi University, is just having a community. In terms of cons, we all know that there have been strikes in Moi University. And so what usually happens is, like in internal medicine, that's a 3-year program. We end up having it going for maybe 3.5, mostly 3.5, 4 years. So it doesn't really protract to the 5, 6 years. Initially it did, but currently things are better. So we are, like, I will complete my MEd in 3.5 years. And then, of course, like I said, if your research is not moving, then it doesn't matter how much work you're putting. You really need to have defended your thesis by the time you're doing your final examination. We don't have a stipend, of course. So that means if you're a self-sponsored registrar, it's important to think about how you will be able to moonlight or just find other ways of research that could give you some money for your family and for yourself. The school fees here, I forgot to mention, is 189,000 every year, which for 3 years comes to about $500,000. That's fair. So I think it's reasonable. And then cons, like I've said, if your research is not moving, we have some support from our supervisors. but most of the work is usually heavy on you. And there's a financial cost to it, meaning you have to pay your biostatistician, you have to pay your research assistants. So that's usually, it's largely, you need some financial support. And unfortunately for Eldoret, there's not as many opportunities to moonlight as in Nairobi. So locum rates here are around 7,000 for a shift, which I think is less than rates for Nairobi. So it's important to kind of think around that and see how you can kind of cut down. I think in residency generally, if you're not, most of you would be self-sponsored. I think it's important also to think about how financially you will be able to sustain through school. My closing remarks, I appreciate Moi University. I appreciate the department and the efforts they make to kind of give us exposure to high resource consultants, high resource setups, and also the opportunity for community. So I do appreciate Moi University. I think the thing that's currently being worked on is to kind of bring down the strikes, so that if a program is a 3-year program, you're finishing in 3 years, but currently it's about 3.5, 4 years. I think that's all I have to say about the program. I'll take it back to Dr. Eden for any questions.
Thank you so much, Doc, for that wonderful presentation about Moi University, the salient differences between the two. And I think the audience can notice that. So I'd like to open the chance for any questions, any comments before we move on. You can post your questions in the Zoom link in the chat. Any questions in the chat? You can also go ahead and want to ask a question straight. Someone is asking, is the environment okay? Is the environment friendly with the senior consultants? Basically, what they're asking is it a toxic environment, or it's a chill environment, or it's a professional environment? And then the other one you can take in is the AMPAT. Someone said, kindly expound on the AMPAT.
Okay, so thank you for that question. In terms of toxicity, I haven't been to UON, so I can only comment about Moi University. I and I think the colleagues around me have experienced very minimal toxicity. If anything, I think our consultants, I would say, are strict. We've not had incidences of an individual consultant focusing on an individual registrar and kind of derailing their time in med school. A lot of the people who've been here longer than they should be, it's purely because of their research. So I appreciate that there's minimal toxicity. I guess currently the trends are moving towards less toxicity. So I wouldn't say that, I personally wouldn't say that there's toxicity in internal medicine department, and I think my colleagues would agree on that. Then in terms of the Moi University Consortium with AMPATH, it's a collaborative academic and research network that brings Moi University and other collaborative universities. Mostly it's usually Indiana, Duke, and Brown University. I think there are others for other departments, but for internal medicine, those are the departments, those are the universities that we usually partner with. And what happens is we have all through the year, we have visiting consultants, pulmonologists, cardiologists who we are able to interact with. I think it kind of gives us a broader, it gives us exposure to how ideal management for patients should be. And then it also allows us to do our electives abroad. The electives is usually fully catered for by the consortium, so we appreciate that. But basically, that's what it does. It gives us an exposure to what happens in other places, and also allows them to come here. It's kind of an exchange program between us and them.
Doc, someone asked about how do they select registrars who go to the AMPAT program. Let me start, the nitty-gritties is what someone is asking. Like,
Okay.
first of all, I think it starts with someone wanting it. Yeah.
Yeah, it has to start with you wanting it. And then the slots are usually about 6 to 8. So if you're a class of 10, that means only maybe 6 people can go because it's usually 2 for every institution. So 2 go to Brown, 2 go to Duke, 2 go to Indiana. And it's usually based on merit. So if you're 10 and the slots are 6 or the slots are 8, then that means the top 6 or the top 8 are the ones who will get the opportunity. Yeah, so that's usually how it is. You have to show interest. Most of the times, everyone has shown interest, and then now it's based on merit. So they will pick the top students, and by top I mean they bring an aggregate of your common courses, which is the biostatistics, the research methodology, the epidemiology, then your ward attendance, because after every farm that you're in, you need to get an assessment where the consultant gives you either a 90% or a 60%, and then your cuts and your end of year. So the aggregate of that is what is usually used to decide who goes for the program.
Awesome, Doc. That is really awesome. I think someone misunderstood the question of fees given to registrar. This means private. I think that's what you're talking about, Dr. The private work.
Yes.
And then someone is asking how many students are admitted in the program.
We're usually about 15 students admitted to the program, but mostly about 10 show up, 10 to about 12. So our classes are usually, per class, you'll find about 10 people per class. And sometimes, of course, as people drop off due to certain reasons, then you can find yourself at around 5 per class, yeah. But the people who are usually admitted are about 15.
Someone is asking what happens to the students? What happens to the students that don't go to the US? Doc, you can take that. The students that don't go to the US, we continue with the program.
Oh, what? So they do their options to do your electives in Aga Khan Hospital and also Kenyatta National Hospital. So those are the other 2 places that you can do your electives locally. And you can also decide to do your electives in your own privately organized facility in Cape Town or wherever you're able to fund yourself. But now, if you're going to if you're applying for the consortium electives, then that means you kind of have had to have qualified for that, so that you get a full scholarship and some stipend even as you're in the US. Those ones who don't qualify do their electives in Aga Khan or in Kenyatta National Hospital.
For the young ones, for people asking about this, I'll put it in context. Like in the University of Nairobi, there's a program like that for University of Washington, I think, and there's a partnership with the Naivasha District Hospital and the University of Washington. For some reason, for the last 3 years, no one has shown interest to go there. And I think it first of all starts with your interest, and then it becomes competitive, like Lucas said. It looks like there's a more robust program of the consortium in Moi than UN. Doc, someone is asking, are there people who actually managed to finish in 3 to 4 years with the previous strikes?
Yes, so I mean the current senior class will be finishing in 3.5 years. We have had some people who finished in 3 years, but most people finished 3.5 to 4. Because of the COVID effect, we had some people finishing 4, 5 years. But currently it's 3.5. I think as you're coming to Moi University, a realistic goal is 3.5 years.
I think that can be said for UN as well. A realistic goal is usually 3.5 years. All right. I don't see any other questions. Oh, someone is asking about school scholarships. Are they available?
The school scholarships are not as robust as in the University of Nairobi. I have seen people applying for what's it called, help for help, but I'm not aware about any school scholarships. I think they are not as robust as they are in University of Nairobi.
All right, Doc. I think someone is asking how many people apply for the consortium out of the 15. I think most people will be interested. Yeah, Doc.
I don't know if I have the just roughly looking at the email that was sent. I think we might have been around 40, maybe around 40 to 50. Yeah, when I was applying, but I don't have an exact value.
Okay. So it's the entire school that applies. It's the entire program that applies for that, huh? There's a lot of interest in the external externships, is the external rotations. Someone is asking, yeah, how long do you go to the US for, and is there a stipend?
So you go to the US for 6 weeks, and there's a stipend. The stipends are different based on the hospital that you're going to. So I think for Indiana, you're given a bigger stipend, and then you take care of your meals, but accommodation is fully provided, but the stipend is sufficient to take care of food while you're there. And then for Duke, they shop for you every week, they give you an accommodation, and then they give you a less stipend, but for every facility you're given a stipend, just that it's different from one facility to the other. So they take care of your visa, they take care of flights, they take care of everything that needs to be taken care of, and they help to facilitate the whole process. So you usually don't end up spending any amount. It's a good thing that they give you a stipend, because then that means you're able to travel a little bit when you're there. But it's not a significant amount, just enough for you to be able to shop a bit and to travel a little bit.
Right. I think that's clear on the issue of the external rotations. I don't see any other question. Must have you practiced for 2 years for you to qualify, or 1 year is still enough?
You actually don't have to. I know someone who's joined the program, and they
we take people right from internship. It's the same with you right now.
Yeah, I've actually, even I only worked for about a year, and currently we have someone who just finished their internship so they're in their part 1. They just finished their internship around August. They were already applying as they were interns, and now they're already in the program.
So that's why we're encouraging the internship class to come and start this, because you can start your MMed right from internship. Someone is asking about how is the security currently. I was there. There was a time where there were rampant cases of robbery with violence. I've never had that. Maybe Dr. Ciela can.
Yeah, maybe Dr. I personally have lived in Nairobi and have lived in Eldoret, and to be very honest, I like Eldoret. I like that it's slow. I like that you can have some work-life balance. Yes, I don't know that the security issue. Dr. Ciela can talk about it.
All right. Thank you so much, Doc. Someone is asking a philosophical question, but that one I think we can answer in another forum. it's another discussion. How is the job market for physicians is flooded? I think we can have that as another webinar. As right now, let's talk about the program and programs are. And thank you so much, Dr. Fauna, for giving us your time. It was insightful, even for me, from my UN side, looking at how you're doing great stuff over there at Moi. And thank you so much for taking the time to take us through this. We will appreciate it. And right now, we welcome Dr. Ciela Cherono, who is the Chief Reg of the Pediatric Department at Moi University. And she'll be taking us through a few of her slides. And we welcome you, Dr. Karibu, to the program.
Hi, good morning. Thank you for the opportunity. So I'm Dr. Cherono, the current Chief Reg at Moi University. So just basically an overview of pediatric residency, where this is a program that trains pediatricians, and the purpose is just to, of course, train competent pediatricians who are capable of diagnosing, managing, and preventing diseases in children, because children are not young adults. And the most important thing is just to develop good communication skills with parents, for you to be able to like explain to them what the child is having, just to take them through everything for them to understand. So communication is very key in our training. And then also it also prepares one for subspecialty, the fellowship, if one desires to continue with their specialization. So the training site is at Moi Teaching and Referral Hospital. We have a children's hospital. It's called Shoe for Africa, where we just have a full hospital for children. It is so of course it's we have an MOU, as Moi University, together with the MTRH, where we serve a population of so many children. I think we see over 1 million kids, because we serve the greater part of the Western region. We get kids from Western Kenya, from North Rift, from Turkana. We also get kids from Lodwar. We get so many kids also from the bordering countries that Uganda, Tanzania, and Sudan. We see so many children from those areas. And then the duration of the training is just basically 3 years, whereby it's important for you to complete your core rotations just to be a competent pediatrician. And as Fauna had said, that basically in Moi University, learning is self-directed learning. Like, it is upon yourself to decide the kind of pediatrician you want to become, competent or less competent. Is this basically problem-based learning, whereby we are usually given cases and we have to solve it amongst ourselves. Our program runs for 3 years, whereby we have year 1, year 2, and year 3. In year 1, this is basically broad exposure. We first start with the common courses, whereby it is mandatory for one to be versed with the statistics, because you will have to apply it when you're doing your research. Of course, your epidemiology and your research methodology, which you have to pass in year 1. And then after the first 3 months of exposure, you will now go to the wards. Either you'll start with your general pediatrics or newborn, and then you also have your sick child rotation. And the good thing about pediatrics is that from year 1 to year 3, you have your 28 days of leave, regardless. In year 2 is now where we have the introductory lessons, or teachings to the specialty courses, whereby we rotate in cardiology for 6 weeks, nephrology 6 weeks, radiology 2 weeks, dermatology 2 weeks, oncology 12 weeks, mental health 2 weeks, elective 6 weeks, and general pediatrics for 24 weeks. Then, of course, you have your 28 days leave. And the good thing about us in Moi University, we also get the exposure during your electives just to go to the US, whereby you go there for 8 weeks. If you're doing your rotations in Kenya, you do it for 6 weeks, but when you go to the US, it's 8 weeks. After you have successfully passed your year 1 end of year exams, then you'll proceed to year 2. Our year 2 is a bit relaxed, because you just do, most of the times after you're done with your general pediatrics rotation, you get to do your specials for around, 28 weeks. Year 3 is now your final year, whereby you have to rotate again in the newborn unit. You have to do your general pediatrics. You have to also now do HIV, neurology, ICU rotation, ophthalmology, ENT, gastro, and you still have your leave days. So the good thing about all these trainings, like in year 1 to year 3, we have this, we have our special, like there's different specialists in our hospital. At least currently, most even our consultants tell us that we are the luckiest lost, because the doctors who had gone for their fellowship are now back. We have a neurologist, we have 2 neurologists, we have an ICU specialist who's the intensivist, we have a couple of ID consultants, we also have a gastro specialist, we have cardiologists, we have nephrologists, which has made the training more interesting and very good, if you ask me. So what are the departmental program? So we usually have teachings every Monday afternoon, whereby we discuss different sessions. We have different topics whereby all the consultants and the residents log in. We discuss different topics and how to approach it. We usually have mini round whereby we get an interesting case in the ward, have it presented on Wednesday. And of course, you'll have your facilitator being the consultant. The registrar is the one who presents together with the fifth year, whereby the fifth year does the summary of the case, and then it's the registrar to discuss, and your facilitator just to add on what you had missed, maybe in the presentation. Every Wednesday of the month, we usually have infectious disease sessions, whereby we have different topics. We have consultants from across the country, across the world, because we usually have our sessions together with consultants from the US. We have a strong relationship with consultants from Indiana, Browns, Duke, whereby they take us through the different sessions most of the times every Wednesday. And also AMPATH is a very big supporter in Moi University. And then you also get teachings from visiting professors and consultants. Like we usually have neurologists visiting from the US. We also have a hemato-oncologist. We also have infectious disease doctors. And then we also have the house pediatricians who just come and just show us what they do differently, what they teach, and how they deal with their cases over there, and how better we can incorporate their teaching and ours, which, if you ask me, the exposure is very well, because at least we get to have sessions on how well they manage their patients. We also have visiting residents. Like across the year, you will never miss a visiting resident from the US, even from Netherlands, at MTRH. So we are able to discuss cases, just share ideas on how they handle things and how best as we handle our issues. So, and the good thing about Moi also, in year 1, usually you have to come up with a research topic. You do your proposal. For you to do your end of part 1 exam, it is mandatory that you have your IREC approval, whereby you've been given the approval to carry your research, go out, collect your data. In year 2, the good thing is that you can analyze and just do your mock defense. If you are able to do it well, you will, after you get if your mock is successful, you will do your school defense. So the good thing about our department, like it's not tied to year 3. As long as you're ready in year 2, you can go ahead and do your research dissemination, which gives you an upper hand, because after you're done with this, you're now left with just reading and just doing your word work and just polishing up in your clinicals. So we usually have an online application, which is 2,000 bob. Application usually open around April and May, whereby after you've been successful, of course, you need to have done successfully completed your internship, maybe worked for a year or 2, then you'll be shortlisted, come do your exams, whereby you do an MCQ and an oral examination. Feedback is immediate. By the time you're finishing the day, you'll know if you've been taken or not. And intake is usually September and October of every year. So from September to December, you do your common courses. They're just fundamentals about statistics, epidemiology, and research methodology. Then from January, ideally, you need to now start your general pediatrics. Yeah. So what are the skills developed? Of course, you'll have like vast clinical skills, your diagnosis and management skills. You'll be a very effective communicator, research skills, because we are the ones who have to collect data, of course, together with our research assistants, and then leadership skills, because we all have to be leaders at some point, and then you just being able to make the decisions, like doing your word on it. You will have to, it's going to help you polish up in your leadership skills. And then the good thing about your clinical skills is that we usually have a consultant almost every day in the wards. And the good thing is, the specialists like the neurologists, cardiologists, they always come to the wards. You have to review cases with them, even if you're not rotating in the different specialities. So they come to the wards, you discuss cases, they teach you. You can maybe have sessions like teachings together with them. And then, of course, they will help you with just formulating a better diagnosis and how to manage these babies on top of what you had presented to them. So, and the good thing about the career pathways after residency is that you can just become a general pediatrician. You can decide just to do your inpatient, outpatient, and just maybe to run your ward rounds, just to be a general pediatrician. After 2 or 3 years, you can decide just to do into fellowship, whereby you can do in neurology, cardiology, infectious disease. We also have in nephrology. Yeah, basically that. And you can also go into academic medicine, whereby you can decide to become a professor. And then you can also decide to go into research, where we have a couple of consultants who have gone into research in pediatrics. So what is the benefits of doing your residency in Moi? It's student-led learning, whereby I feel like it's good because you're the one who's tasked to do a topic. You have to like do a thorough job because you usually have classes. Our classes are not fixed. It just depends on how available the consultants are. But the good thing is by the time you're doing exams, you will have completed all the exams, all the classes. So it is you have to like just present the class, and the consultant will come and add on what you missed and what you need to maybe correct if it was not right. You also get the opportunity to go to the US for electives in year 2, which is just fully sponsored. They give you stipends, they pay for you the flight, everything from application of the visa till you stay in the US is from the department. Leave days from year 1 to 3, which I feel like it is good because school can be too much. There are days where you feel like you need to decompress. So you just take your 28 days, go rest, then come back. You also get to the opportunity to train in different specialties. To me, it is the best exposure. Whereby if you ask me where I was 2 years ago before I joined the program, because I'm almost joining my year 3, where I was, I can say that it has been one of the best experiences that I've gotten because of the exposure, because of the consultants who are very supportive, and also mentorship from your supervisor. We start mentorship programs from year 1, whereby you are allocated mentors from year 1 by the department, and they help you navigate and just survive through residency, because residency is not easy. It needs support. The challenges is that you will have issues, especially if you have small children or if you get babies when you're doing your residency. Also, formulating a research topic in part 1, it can be very hard because you can be very green. This is like maybe you're new in pediatrics, maybe you're like an MO in a different department before joining the program. So I feel like it can be a bit tasking. And then also limited numbers. If guys don't report, it can be very hard just because the workload is a lot. Because remember, MTRH, we get patients from Nakuru, Kericho, Bomet, West Bungoma, Kakamega, Kisii, Uganda, Sudan, which to us we feel like it is one of the best experiences because we get to have so many cases in the wards and we get to learn. Yeah. So fees is just as outlined. Per year is 189,700. Throughout the course is around 555,000. If you ask me, life in Eldoret is generally affordable. Life is cheap. It's compared to Nairobi, because I did my undergrad in Nairobi. It's very cheap. It's affordable because we get affordable housing. Food is affordable because we get most of the food from Eldoret comes from Uganda. Yeah, so life in Eldoret is good. The weather is very good. We hardly do we get floods. So if one would consider, I would just tell you, come to my university. The exposure is very good. If you ask me, what I have come to appreciate about Moi University is the exposure that one gets during residency. And that has been one of the best in my residency. Yeah, that's all. I think I am grateful for the opportunity that we are being given at my university in conjunction with MTRH. And if there are any questions, I'd be willing to take up. And I would urge, if you haven't considered where you'd want to do your pediatrics, please come to Moi University. You will end up living as one of the best consultants in the country in pediatrics. See you soon. Thank you.
Hi, Doc.
Hi.
Well,
I hope I've been
hapo
able to convince
mtugonga
guys to
10
come
lakini
to
sawa.
Come again?
Hapo umetugonga 10 but ni sawa tu.
Yeah. So I'm saying, like, where do you do your child health rotations? Us guys, we do our rotations at Moi University, no, at MTRH. And of course, we have electives whereby it's 6 weeks. You can decide. If you can either go to the US, and you can either do it like anywhere in the country, as long as you have shown interest. The department is to just facilitate, recommend you, and you start your rotation wherever you want.
The other questions. Yes, so let me see the new question. So guys, Dr. Ciela has made a passionate appeal and she's presented her program in the best manner possible. Yeah, the pediatric residency program in Moi looks really great. So are there any questions that you have for Dr. Ciela before we move to the next session? No one wants to ask about the AMPAT external rotations. You've exhausted those ones. Hey, Doc, it looks like you've convinced everybody.
Yeah, me, I'm available to convince.
Okay.
So, what will apply to Apuje?
Okay, so there's someone who has a question.
Yes, I have a question.
Yeah, go ahead.
If someone like me interested in going in residence in pediatric in Moi University, is it does it require to sit an entrance exam for pediatric residence before going there?
Yes, you have to do an exam. Yeah, we usually have entry exams. I had said that. We just go to the slide. Usually, you have to do an entry exam, whereby you have to usually the entry exam is done once a year around April, May. You do an MCQ and an oral examination. After you've completed your MCQs and oral, the feedback is immediate. They'll just call, or they can do an email. Or they can send you a message, just tell you that you have been successfully taken for the program. And it is open to everyone, even if you trained maybe out of the country, as long as you convince the examiners that you are up to task and up to speed for the program, you'll be taken.
Yeah, because I'm interested in that field, because I'm working in hard-to-reach areas for previous years in NGO setting as a pediatric. I'm not pediatric for sure, but I'm GP in working pediatric for a long time, and then
I haven't gotten a
I enjoyed.
He's just
The
telling
question
you
is
about his.
is that particular for pediatric only, or is it a general MCQ or general examination for medicine, all medicine, or is it targetedly for pediatrics only? Yeah, I think you.
The MCQ is it's purely pediatrics because you're coming to do peds. This is basically pediatrics. So we usually encourage guys just to go through the pediatric protocol, just to know how to manage the common courses that we usually see what the common courses that we usually see in pediatrics. Yeah.
Someone is asking. Oh, okay.
The other question, last on my list. in, as you mentioned, in career progress or career growth after you complete your residence. I think it's 3 years more university for the residence program in pediatrics. I think so. For the
Yes,
application
it's 2 years.
2020. Okay. The other chance that you have mentioned, some people can go to fellowship or USA or anything. I was very late for that point. Can you clarify, please?
Okay, so about going to the USA, so ideally, after one has reported for your pediatrics, like your master's in pediatrics, what happens? The first thing that you need to do, we usually have 3 months, like you don't do pediatrics, just 3 months basically for common courses, whereby you have an introduction to biostatistics, epidemiology, and research methodology. Because remember, you also have to do research for you to successfully be awarded your master's degree in child health and pediatrics. So after completing year one, whereby you do your general pediatrics, you do your newborn unit rotation, and then you also do your sick child rotation. After you have passed your part one exams, you go to second year. So in second year, you usually have an electives, which is a rotation. So you can either go to the US if you are chosen and selected by the department, and then you can also do your rotation locally. So, and your rotation that is being done in the US, it is fully funded by the department. And us usually go to Indiana University. We usually have 2 slots for guys going to Indiana University. Yeah, for you to do your external rotation. That is the electives in pediatrics, which is mandatory for everyone to successfully complete your master's program. You have to do your electives rotation. Yeah.
It's not a fellowship program. It's an elective program.
No. It's an elective program.
All right.
Thank you. Over to you.
Okay, thank you.
All right.
So I'm just
thank you so much. Yeah.
Somebody is asking, like, do your undergraduate scores influence your acceptance into residency? No, it doesn't. The good thing is you just come, do your MCQs, your oral examination. And the good thing with most of the times that I've seen, if 10 guys apply, they can take 10 of them or even 8. As long as you have proved to the department that you are good in doing like your entry exam was good, I don't see any reason why they should not take you. Yeah.
Look, the final thing is someone is asking MCQs are online, yeah?
It depends. During COVID, it was online. Yeah.
Oh, okay.
During COVID, it was online, but most of the times, I have seen that we usually do it physically. But if you are, because we have students from Cameroon. We had one from Uganda who completed. Them, they were able to do it online. But if you're in Kenya, you come physically. It depends. It can either be online or physical, depending on your arrangement with the department. Asking about how hands-on.
Yeah, go ahead with that. Yeah, I wanted to ask.
Like how one is hands-on in pediatrics. You will be super hands-on.
Broad question, isn't it?
Yeah, pediatrics is good. You will be super hands-on. One, what I have seen in Moi, we are usually not many. In my class, we are like 6. The class ahead, they're like 5. The class behind, they're like 10. So you see, we usually get to see the patients, manage them very well. Of course, we don't get time for locuming. So what are you left with? Just to be at the wards, at the clinics. By the time you're done with the training, I feel like you will be very good, because us guys, we have to complete 80%. And because we are very few, trust you me, the consultants will know you. They will know your strengths. They will know your weaknesses, and they will be able to mentor you on where you need to put more emphasis on. At the end of every rotation, we usually have a clinical examination whereby you're given a case, you discuss with the consultant, and after that, you're given feedback on where you need to work on. Yeah, so by the time you'll be done, you'll be a very good pediatrician, if you ask me.
Awesome. And someone defer after getting a slot. Standard, yeah, you can defer, Doc.
Yeah, you can defer up to 2 times. That's what happens at MOI. That's what happens in the pediatrics department.
All right. And someone is asking about leave. Is it for it's only it's for everyone? There's leave days for, and there's an annual leave days for everyone. Deadline for application, Doc. Is your portal open right now?
Yeah, I think the portal is open.
Yeah.
Yeah, I think it's open because you see the current part ones are almost doing the exam, so we need to have you guys joining us in the department very soon.
Okay. So you can go over to the MOI portal and then start your application from there. And one before, yeah, we have answered that.
Yeah.
I think that's pretty much it. Thank you, Dr. Ciele, for the passionate presentation. You've appealed your case and you've given great insight. Someone is asking, also no night course, my friend, pediatrics. Doc, pediatrics.
You learn at night. That is what the department says.
Jalen,
So, yes?
can I ask a question?
Yeah.
This is very interesting. I think it's interactive sessions, huh? Is that right?
Yes.
Yeah. The question is, I've been visiting for the last 3 days, before 3 days, for MOI Postgraduate 2026, 2027. I think pediatric for the year it's 187,000 in Kenyan shilling. That's the native payment, I think. What about the foreign students or international students? Can you help me to know that the exactly yearly payment for in order to set my whole year installments? For Kenyans, I think 187,000. For other international students, I think they're adding about 20%. Is that right? I've heard that.
Yes.
Okay.
So if you can ask me, if I can say, I think the reason why we also have like a couple of foreign doctors training at the university is because it's pretty much affordable. Like affordability from the tuition fee, from accommodation. And then the good thing about our department, we have very good consultants. Like the consultants, like I can speak with the current HOD, Dr. Njuguna. He's very supportive. He is very passionate about seeing doctors completing their training within 3 years. If you ask me, it has happened. The last 2 classes that have graduated, we have seen them completing in 3 years. Like it's as long as you have defended successfully, you have passed the examination, and they feel like you are very good in your clinical work, and you are a competent pediatrician, trust me, they will let you go. They don't hold on people to cover with the deficits. The HOD says that we are not here to cover deficits, we are here to learn. So if there's some gaps, it is not for us to cover. Ours is to successfully complete our rotations and to satisfy the board that we are capable of being good pediatricians out there, and we will graduate on time.
Thank you so much, Doc. The question about the fees for international students different from the ones that you quoted, or are they the same?
It's not the same. I think they pay with the difference could be between 20 to 50,000. From
Yes.
what I asked my classmates, around an extra 20K that you pay, which could be 200K per year, which you see that
Yes.
is affordable.
Yes. It is. It is. I don't think there are any more pending questions. Doc will go to the next presentation. Thank you so much. We appreciate this you coming through. And all the best. And have a
As I
good day,
close,
Pia.
thank you, Doc. If anyone has a question, you can always find me on my social media platform as Cheryl Sele. You can DM me and I can be of help. Thank you so much for the opportunity. See you soon.
Awesome. That's how mentorship starts, guys. So you can reach out to Doc and she will support you. So our next presentation, and unfortunately, the Chief Registrar for Pediatrics has had power issues. So we will not be having the pediatrics, unfortunately, the pediatrics presentation from the University of Nairobi. So we'll straight move to obstetrics and we'll start with the Moi University Obstetrics Department. And we have Doc here who's ready to present. Dr. Are you in the call?
Hi, yes, I am. I'm just trying to log in with my computer so that I'm able to share my screen. Just give me 1 minute.
All right. All right, Sad. So guys, as you're waiting for Doc, I'd like to tell you about a program that we're running currently. I'll share my slide. Okay. Let me share my screen. So if you see my screen, I wanted to show you our our website that we have that supports students. So we call Paeds Medicine. Paeds Medicine is a site that prepares students for exams, undergraduate and postgraduate medical exams. So we currently have these are CMEs that we've done for students who want to go to the US, if you want to go to Ireland, if you want to go to Australia. These are the programs that those are the CMEs that we have attached that you can watch at your own time. This is for undergraduate students, medicine, dentistry, and pharmacy. And if you go down there, this is for students who are foreign trained and who want to come work in Kenya, and these are the exams that they do. And then we have the entry exams that you guys will be doing, but we have domiciled the entry exams into the 4 departments. So, for example, you want to do obstetrics and gynecology, and you're planning for your entry exams. You click on obstetrics and gynecology, and then you click on the entry exams. So the entry exams is an MCQ that you can prepare for your exams at. This is mostly based on UOL, but if you don't have materials for MOE as well, you can click here and join. And the same for IMED, and the same for pediatrics department. So we're going to share our WhatsApp link right now in the group, and if anyone is interested in the entry exams, and then they can join. So it's a subscription based, it's affordable. The other day I was photocopying papers for IMED for entry exams, and it costed me about 3,000 shillings. And then this is way cheaper than that, and you can revise at your own convenience while you're studying, while you're on your phone. So it's a web-based application, and it's easy to read. And the questions have been University of Nairobi questions for the past 5 to 6 years, and they've been reviewed. They've been done by registrars, and then they've been reviewed by consultants. So feel free to join us. Let me share my. I'll share the link for the WhatsApp group, where we'll tell you and how to join this, and the nitty-gritties and how to guide you to opening an account and so on and so forth. So without few remarks, I will stop sharing the screen and allow Doc to come in. I'll answer any questions that you have, so that we can continue supporting you through this. Thank you. So I will share the WhatsApp link here, and then you can tell me, and you can tell us anything that you need that you may need support for, and we will be able to support you. So that is the link I've shared. You can join the group and you let us know. So without further ado, let's welcome Doc to present. Karibu, thank you so much for joining us, and over to you.
Good afternoon, everyone. Thank you so much, Doc, for the opportunity to share. I'm Dr. Faith Rialem. I'm presenting on behalf of Dr. Zipporah Onkundi, who's our Deputy Chief Resident. Our current Chief Resident couldn't be here. So I have a few slides. I've tried to compact everything into what I think would be relevant, but I'm happy to take any questions about anything that's not been included in the slides. So a brief overview of the program. As a lot of you know, Moi University is based in Eldoret, Kenya. We recently upgraded from town to city status. So it's a 4-year program, or rather designed to be a 4-year program. Currently, we have about 6 registrars per year. Some years have more, some years have less. A key thing about our program is the research requirement. A lot of you guys who maybe went to Moi know that Moi is very big on research. So our research program is quite stringent. And I think we pride ourselves in doing really good research. The fees are approximately 180,000 per year, give or take 10,000. I think first year has a little bit extra fee for some of the one-time fees you pay as you come in as a student. So definitely a bit less maybe than some of the other programs that may have been presented. So I'll go over a few details of the program before the details on how to apply. This is basically our curriculum overview. We are divided into two parts, so part 1 and part 2. Part 1 is usually year 1 and 2, though can extend a little bit based on your progress with your research. So really the defining aspect between part 1 and part 2, there's an exam after part 1, and you can only sit for that exam after you have had your research proposal done and approved by the institutional ethics and review board. So in terms of coursework, year 1, you mostly have the basic science courses. You start off with a set of common courses that are shared amongst all the residents from the different departments. So that includes epidemiology, research methods, and biostatistics. And this is basically to help you start working on your proposal, and start to refine your methodology. So right from the start for our program, we start working on our research from the get-go. You start discussing topics as soon as you start in September, October. Then by December, usually everyone is supposed to have come up with a topic, and you present it to the department for the initial approval. So within 3 months of starting at MOI, you'll have come up with your topic, get an idea, get a supervisor, and get for the department to give you a green light before you start to develop the actual proposal. The other basic science courses we do in first year include anatomy, physiology, biochemistry, and so on. We rotate in obstetrics and gyne, so like just a general obstetrics. So we switch in 3-month blocks from obs to gyne and back and forth. So we have a total of 4 blocks each year that run for 12 weeks long. Year 2, we continue with basic sciences, but then now more narrowed down to obs and gyne. So you do your infections in reproductive health. You start to cover pediatric and adolescent gyne. You start to cover topics in maternal fetal medicine. You do radiology that is pertinent to reproductive health, and you also start to do pediatric, like neonatal resuscitation. So you still rotate generally in obstetrics and gyne, but you start to introduce a bit more specialized rotations in radiology, neonatology, and that's a type of gyne oncology is the other special rotation you do in second year. So part 2, once you qualify for part 2, that means you've gotten your research approval, and as well as you've sat the part 1 exam and passed, then you're considered a senior resident. Year 3 introduces more specialized rotations, which include training in laparoscopy, reproductive endocrinology, and infertility. We also have time for electives, which I think when my colleague in pediatrics mentioned, we have opportunities to also either stay in country or go abroad. And then the other thing we do in third year is community-based rotation. So MOI is very big on community-based learning. So definitely this features in your year 3 of training. Year 4 now is more specialized. So you now rotate in maternal fetal medicine, gynecology. You do urogynecology, which for our setup, we work with Gynocare Hospital, if any of you knows about Gynocare. We also do some specialized rotations in anesthesia as well as general surgery. So how to apply? Similarly to the other programs mentioned for MOI, the call for applications open up around this time, and I think it's already open, and I've shared the link for the application website. Specifically for our department, we do have a written entrance exam, which is usually multiple choice. We do an oral interview. I think some years have been done in person, and then sometimes have been done online. Like for example, in my case, when I applied, I wasn't able to travel here in person, so they were able to offer me an interview via Zoom. Usually admission letters go out by the end of July, and the program starts beginning of September. So I'll mention that when you start off, the first 3 months of our program is you've given a lot of time to do the common courses, and you're partly on the clinical rota, just to allow you time to do the common courses. So we do a lot of some shadowing in the beginning, and then you take more independent calls towards the second half of that first 3-month block. So this is a screenshot from the official document that Moi University puts out as the entrance requirements. So you definitely need to be a holder of an MBCHB or MD or any other equivalent degree. You need to be registered by KMPDC. They usually want you to have worked for at least 1 year after internship. And I think part of the reason is when you come in, Moi has a lot of autonomy for residents. So they sort of expect you to know a lot of basic things in obstetrics. Of course, there's things you will learn when you come in, but things like doing a cesarean, a lot of people will expect you to know at least how to do the basics of a cesarean section. Then, the admission interviews by the department. And then we have a lot of students from foreign countries, so they have to show evidence of proficiency in English language. I don't know exactly what that evidence is, but in case anybody has questions on that, I can link you up to some of our foreign students at Moi, and they'll be able to give you further information. The cost, 187,200. I think in second day, it's 178. So in terms of challenges, I started off with challenges and then we'll talk about opportunities, because I think challenges can also be forms of opportunities. So I think everybody knows that more we've had some issues with industrial action from our lecturers, which has led to some delays in our progression. I will say that I've been part of 2 industrial actions, and in one of them, we were not able to continue with our clinical learning. But in the second one, we were still able to continue with our clinical rotations and they counted. However, our classwork, our coursework is what was impacted. Compared to programs like UON, we definitely have fewer residents. So if you do the math, that means slightly heavier workload for our residents. But again, that could be also a good thing because you get a lot more learning opportunities. And then this is for self-sponsored registers, which unfortunately is becoming the majority year after year. Myself being one of them is, everybody knows that these programs, MTRH and KNH, they don't pay registrars. And this is something we hope will change in the coming years. And I think there's already discussions on that from what I hear from the union. So in terms of opportunities, MTRH gets a lot of referrals from everywhere, including South Sudan. So we see a lot of pathology. We see very weird, crazy cases that you might not see elsewhere. And this is really great to see while you're training, because one time when you're out there as a consultant, then you will be comfortable knowing that I have seen this before. Because of our fewer numbers and our high case volume, we have ample opportunities to really do surgery and refine our surgical skills. I think residents who graduate from Moi have very good surgical skills, and this is because we have a lot of opportunity to operate. In gynecology, laparoscopy is becoming a big thing. And over the last 2 or 3 years, we've really ramped up our program. So we have elective laparoscopy theaters every Wednesday. We do our ectopic cases laparoscopically. And so, everybody who goes through this training has an opportunity to, by the end of 4 years, to be able to do a laparoscopy case from start to finish on your own. Again, the opportunity to do electives, especially for people who might be interested to go abroad. We have a partnership with AMPATH and some of the other consortium universities, including Indiana, Toronto. So we do, every year we have some of our residents go abroad. In terms of different subspecialties, because some people might be interested in furthering their training, we have a very good MFM and gyn-onc programs currently. I think MFM is probably one of the best we have in country. And then we definitely have gyn-onc. So, you rotate in gyn-onc, you see some of these major surgeries, you see rad hysts and things like that. And then to add on to that, we're starting a pediatric and adolescent gyn fellowship soon. So we've started to do our clinics. We're changing our curriculum to include that as part of our rotations in your senior years. And then finally, I think as Dr. Cielo said, for people who've lived in Nairobi, when you come to Eldoret, it's really a a nice change, it's a breath of fresh air. We don't have as much traffic, even though we are now a city. You can sometimes take call from home because you can easily get to MTRH quickly. The cost of living is lower than in Nairobi, and if you have a family, there's schools, there's decent housing available. I even know some of my colleagues who've been able to buy land and build homes, just because it's definitely accessible. So it's definitely a nice place to live in. And the weather it gets cold, but I would say it's not so harsh. And I think that should be my last slide. So in case I didn't say anything, I'm happy to take any questions.
Thank you, Doc, so much for this. I like the really hands-on aspect of the program. Could you define for our audience what MFF, maternal fetal medicine, and gyne-onc, what do they mean? What do they entail?
Sorry, Doc, I missed the last part of your question. What about MFM?
The subspecialty programs that you have, could you define them further?
Yes. So right now we have fellowship training in maternal fetal medicine, which is basically if you are interested in really going further into all the different conditions that happen in pregnancy and all the fetal conditions that can happen, basically high risk pregnancies. Then that's the field for you. How it benefits us as registrars is we have fellows. So we have fellows who round with us in our antenatal wards. We have very good ultrasound machines, and they do some of their detailed anatomy scans. We get referrals from all over for high risk pregnancies, anywhere from conjoined twins to Akrita spectrum, the preeclampsia varieties, eclampsia. We have cancer in pregnancy. So because we have the availability of not just fellows, but we have MFM trained consultants, then we're able to get these patients referred to us. So we also get to learn and see. In terms of gyne-onc, I think we get referral for cervical cancer, ovarian, uterine malignancies. We have a lot of patients with gestational trophoblastic neoplasia. So you get to see how these patients are managed. You see their surgeries done, their debulking, and and basically, we do cervical clinic, dysplasia clinic. So you see colposcopies, you see LEEP procedures done. So I think, definitely having the fellowship program is a plus for the residents because we work hand in hand with the fellows when you rotate with them. Yeah, so pediatric and adolescent gyne hasn't started yet, but it's slated to start this September. So anyone who's interested in gyne conditions that affect children and adolescents, which include congenital anomalies, things like that.
Thank you so much, Doc. Someone is asking, correct me if I'm wrong, exams are done after part 1 and part 2, so you do 2 exams in 4 years.
Yes, we have a part 1 exam, which is midway through your training. And then you have your final exam, which is part 2. That's the one you take so that you can graduate. That's basically the last thing before graduation. But before you take part 2, you need to have finished your research and defended your thesis, both at a departmental level as well as at a school level, school-wide level.
Awesome. I can see people now are using the lingo that you use part 1, part 2. So people are really learning. That is that's a great feedback I can see. Any other questions, guys? You can post it. You can ask it live.
I see some questions in the chat. Let me try to answer. So I think the first one is, do you do dissections? Yes. So in your first year, when you do anatomy, we go to the anatomy lab and we dissect the cadavers. So for our program, we mostly focus on the abdomen and the pelvis. We don't do dissection for the full cadaver. And then somebody asked, you said no remuneration for self-sponsored registrars. Are there other registrars that aren't self-sponsored? So we do have registrars who are sponsored by the counties. And so they get study leave, which means they continue to get a salary from the county while they're in school. But that means they are bonded and have to go back to the county and work for them for a certain number of years. Yeah, so we do have registrars who continue to get a salary from the county, but that number is becoming less and less as time goes by because fewer and fewer counties are releasing people to go back to school. So somebody says, correct me if I'm wrong, exams are done after part 1 and 2. So you do 2 exams? Yes. So you do part 1 exam, which is halfway through your training, and the second one before you graduate. Departmental versus school level. Yes. So for us, when you prepare your thesis and you're ready, you first present to the department a mock defense, and you get feedback from the consultants within your departments, your fellow registrars. And then now you have to, once you've done that, then you are cleared by the department to apply for school defense. Somebody's asking, is OBGYN flooded? Sometimes if you might get the sense that there are so many OBGYNs, but if you really come out here in the rural areas, there are not that many OBGYNs. So there's definitely opportunity to practice. Somebody asking, are you able to do locums as you go through the program? I would say yes, you have to be aggressive because, Eldoret has a lot of other registrars and the opportunities might be limited. So if you're able to, you might be able to get time here and there, but it will require a sacrifice on your part. You might be able to do a night shift somewhere. So I will say yes, there's opportunity to do locums. But I will say if you're planning to go back to school as a self-sponsored registrar, which is unfortunately going to be the reality for a lot of people, is while you're still an MO or you're still an MO intern and you have a salary, you minimize your expenses and save as much as you can. Something that will cushion you for a while before you get settled in Eldoret and even know where the locums are, because they're not readily advertised. You might need to know people or know colleagues before you know where the opportunities lie. So you need to be able to cushion yourself. I think those are all the questions from the chat, unless somebody else wants to unmute or post in the chat.
Yeah, guys, if someone has a question, you can unmute and ask it live. And if you want to ask in the chat, that's fine. You can also ask in the chat before we move on to the next presentation.
I would like to add something else that I wanted to emphasize is training at MOI really teaches you independence very early on. So, right from the classwork, we do a lot of self-directed learning, and it also cuts across clinically. So, I don't know if I would call it baptism by fire or what, but basically a lot of our registrars, have to make some decisions initially. So basically the program is designed to really teach you independence and to also learn, when to ask for help and, and how to really it's very self-directed learning. So people come out of here feeling quite confident to handle things on their own. There's a question on a daily routine. So I will be careful to comment on that because our structure is going to change soon on how we rotate. So it might be different by the time you come. But as it is now, we try and have days for where you rotate and take call, and then other days you might find yourself being free, but we consider it an academic day or a self-directed learning day. As it is right now, our hours are about 40 hours, but I think that might be changing soon. So, you might have two acute calls, you might have an elective theater that week, and you might have a clinic. And then we also work every other weekend. So we try to give people off at least 2 weekends in a month, and then the other weekends you work. Somebody's asking about tutorials. Tutorials, yes, we have classes. So different classes will take different forms. Sometimes you do it in tutorial form. Sometimes you do it as a lecture, an overview lecture. Sometimes it could be a hands-on training. As somebody asked about leave days, yes. So for our program, we get 4 weeks of leave per year, which is divided. You take 2 weeks in the first half and 2 weeks in the second half. We also get 1 week for Christmas. So our Christmas holiday is 2 weeks long. We divide ourselves, and half of the group will cover the Christmas week. The other half will cover the New Year's week. So in total, about 5 weeks off in a year, which is fair.
Like the questions are over. So with that, we'd like to thank Dr. Faith for coming through. Doc, thank you for the clear, concise presentation of the program. I think it's a rich program, and students who are interested might be able to really focus on that and join more as an OBGYN registrar. And I've seen doctors who've come through that, and they're really great doctors. Asante sana, Doc, for the yes, I agree. It was well articulated for the presentation.
Thank you, and most welcome. And I want to encourage people to apply and come to Moi. I know there might be some not so good talk about Moi, but being a registrar here myself, yes, every program has its pros and cons. But honestly, the main bottom line, we want to leave a program being well trained and feeling confident that you can practice as a consultant, and you will get that at Moi despite all the different challenges we have. So thank you, everyone, and have a good day.
You too, Doc. Thank you for this presentation. So for now, we will move to the University of Nairobi, where we will invite Dr. Claire to be presenting her slides on our behalf. Doc, are you in the call so that I start presenting?
Yes, Doc, I'm here.
All right, so let me present. Am I on slideshow?
Yes.
Let me
So
go
good
back.
afternoon.
Doc.
Okay, good afternoon, everyone. Thank you, Dr. Aiden, for this opportunity and for such a thought of this mentorship program. I think it will go a long way in helping the incoming residents to choose and also prepare mentally. So I know Dr. Cherono Siele joked about the floods in Nairobi. Yeah, and with the floods come power outages. And so that's why Dr. Eden has been kind enough to share the slides on my behalf. So I'll go straight to it. Being the last presenter, I know most of the things have been talked about in terms of the intake, the fees. So I'll just go straight to what is specific for OBSGYN and especially in the University of Nairobi. My name is Dr. Karen. I'm the Deputy Chief Resident, OBSGYN UON. So I see OBSGYN as a combination of medicine and surgery. So if you like medicine and also like surgery, I think this is best for you. Also with the Ministry of Health focusing on reducing maternal mortality rates, you'll be involved in high impact life-saving interventions. This will also serve as a background for your subspecialization earlier if you want to go into fertility, urogynecology, maternal-fetal medicine, and even oncology, then this is the field for you. Next slide. So for the entry requirements, I'll take a very few minutes on this because it's been talked about. So application is through the UON portal, and it's usually open from around March, April. I think it's already open now. Those are the requirements, MBCHB, you've completed internship, have a valid medical license because you'll be practicing basically. And then the usual recommendation letter, CV. And then for the entry exam, we have MCQs and then oral interview. That's around May. So for the MCQs, it's a hybrid. They are done online, but physically. So you'll come to the Department of Obsgyn, UON, but with your laptop, and then you'll do the MCQs online. The feedback for MCQs will be immediate, and those who will proceed will now go to proceed to interviews, which will be a panel of 2 members of faculty who will now interview you, give you sort of like a viva, so some oral exam, and then now get to know better about you, your background, your experience. And for the current year ones, the current part ones, they emphasize more on having at least some experience, because as my colleague from Moi said, you need to have some background and basic surgical expertise, at least to be able to do basic CSS, maybe explorative laparotomy for ectopics. So maybe at least 2 years post-internship would be ideal. And that is what they did for the current year ones. So there is 1 intake per year. So after that interview around May, you get your feedback by June, July, and then you start classes by September. And once you start classes, we usually call them modules. There'll be also an opportunity of shadowing, a period of 6 to 8 weeks that is split into 2. So in this shadowing, you'll be attached to a senior resident and you'll be with them throughout the entire shift. So this will be able to show you around KNH, the systems in KNH and how things are done, and you'll be able to also polish your surgical skills as you wait to start your proper clinical experience. Next slide. So the duration of training is 4 years, but we usually put 4 plus N. N being the number of years you take to do your research, but minimum is 4 years. So how this is split, year 1, you will do your classes on basic sciences, you will do your anatomy, dissection in Chiromo together with the general surgery students. And then in year 1 still, you'll do your clinicals throughout. So, but you will be off the rota when you're doing modules. And these modules are, as has been said, is student-led. So you'll be assigned a topic, you prepare slides, and then in conjunction with your supervisor, you are the one who will present this. And then your supervisor or facilitator will give the remarks after. And we also have cuts after every modules, and this will contribute to a percentage at the end of the year. At the end of the year 1, we have the end of year exams, and I think I'll have a slide to talk about that. And then you proceed to year 2 once you pass. In year 2, it's purely elective year. So this elective year will be out. Some rotations will be outside KNH. And you'll basically rotate in Obsgyn, but in a smaller facility, say level 5 or level 4. You'll also have a chance to rotate in general surgery, urology departments, radiology. Then there are some optional, that's laparoscopy and neonatology. So for this, you'll have a logbook that you'll need to fill before coming back. And then, so that's year 2. So year 2, there'll be no end-year examinations. And then also from first year, you'll start talking about your research topic that you'd want to do. And so during year 2, also as you're on electives, since you are outside Obsgyn Rota in KNH, then it's a good opportunity to work on your research and dissertation. So once you come back to third year, then you continue your clinicals as well as the classes, that is modules. And now year 3 is the rate limiting steps in Obsgyn UON. In that, you cannot proceed, you cannot sit the end of year in third year if you have not presented or defended your dissertation. So you can be in year 3 for as long as you do your until you finish your research. So you can find someone being in year 3 for 2 years, 3 years, or 1 year if you're aggressive enough. But there are ways that the department has put in place mentorship opportunities and really supporting research and doing research trainings to be able to ensure that everyone finishes on time. So after the end of year 3, then you proceed to year 4, where it's just clinicals, classes, and just perfecting your surgical skills. I won't talk much about the fee. I think my colleague, Dr. Gillian, shared. But so basically, it's around 380,000, give or take, every year. Yeah, but you don't have to finish the entire fee at once. You can keep paying as long as at the end of the year, before you sit your examination, you have completed for that specific year. Next slide. So this is what I was talking about. Examinations is in year 1, year 3, and year 4. So the examinations is a combination of multiple choice questions, SAQs, and essay. We also have OSCE, we also have the short case and the long case, which are done in the wards. Next slide. So residency generally comes with responsibilities. And like in undergraduate, now you have work-life balance, balancing social life, and then working, because most students are currently self-sponsored, so you need to make ends meet. So we have on-call responsibilities, and this being you're dealing with real patients, and you being the first contact on the ground. And yeah, sometimes these are emotionally intense cases, and KNH receives almost all the complications you can think of in as far as OBGYN is concerned. So you'll be able to see these cases, and sometimes they can be emotionally intense, and also the high workload. So here I'd like to just mention how I know someone would ask maybe the day-to-day life in the OBGYN department. So OBGYN rotation has been divided into 3 blocks. So we have the obstetric blocks, the gynecology block, and the special block. So for the obstetric block, these are shifts in labor ward, mostly 12-hour shifts. And you have ward rounds in the morning and evening to hand over. So sometimes, depending on how long the ward round takes, it can be up to 15 hours. And then we have the theaters, maternity theaters. We have 2 that run concurrently. So at any given time, there are 2 residents running each theater, day and night. And then we have the antenatal and the postnatal wards, which have different days for their major ward rounds. And then the gynecology block now is the one that deals with casualty shifts, the acute gynecology, like the ectopic, and then we have elective surgeries. So for the open, we have 3 theaters per week, each having about 3 patients. So at least you'll be able to get surgical expertise. And then we also have, which is a con or a challenge, is we have a shift that is called K24, which is a 24-hour shift, but it's on call. And this is the person who sorts out any emergency theaters, be it ectopics, be it DNCs, and all that. So that is about the gynecology block. So then we have the 3rd block, which we call the special blocks. This is divided into 2. So we have gyn oncology, which have now their own theaters, their own wards, ward rounds, colposcopy, LEEP, EUAs, name it. And then we have the 2nd group doing laparoscopies. So for laparoscopy, we have 2 theaters every week. And then we also have ectopics done laparoscopically. We also have urogyn under this special group. And then the reproductive endocrinology and infertility, and also the special clinics. So each block, you do 2 months and then rotate. So 2 months, then move to the next, 2 months, move to the next, like that. So at least you are able to have the intense obstetric blocks, and then you can go to a lighter block like specials, relax a bit, come back again to OBS after some time. So at least it's able to give you sort of a break. At the same time, you're able to be exposed to these other specialties. Yeah, next. So
Okay.
after the cons, we have the pros. So for the pros, we have it will form a background for the subspecialty fellowship. And currently, the fellowships that are offered by UON Obsgyn department are 3. That's maternal-fetal medicine, which my colleague from Moi has talked about, gyn-oncology, and then the reproductive endocrinology and fertility. And KNH is now in the process of opening a fertility center. So already patients are being booked for this, and we'll be starting IVF. I think it will be the first public hospital to offer IVF. So it will give you good opportunity to see and even decide on which area you would want to subspecialize in. And as we've talked about, you'll get surgical expertise as well as exposure to rare complications. The other pros that I didn't put here is that we have a welfare committee. So this welfare committee looks into the welfare of residents, organizes welfare webinars depending on the needs of the residents, organizing support when one maybe loses a family member or is battling a challenge. And also we have an annual gala dinner that is organized by welfare committee. So it's an opportunity to meet with the lecturers outside of the KNH-UON environment. We also have mentorship opportunities. So once you join, you're assigned a mentor by the department. And we also have leave days, though I now notice that our leave days are less than compared to our colleagues. So we have 2 weeks leave days. That's 14 days in a year. But for the international students, we give them a special consideration because if they need to travel, then 2 weeks is not enough. So we give them 4 weeks. I think that is it, unless I've forgotten anything, then I'll be happy to take any questions. Thank you.
Thank you so much, Doc, for the great presentation. I like the fact that we're moving towards more subspecialization at UON. Positive step forward. Let me invite a question from the team for obstetrics. There's one question about any age limit for AMID. That's for all of us, but we're taking the mic right now. You can answer that.
I don't think there's an age limit because I think one of our residents is even aged, is over 50. Yeah. So there's no age limit. But the earlier you do, the better because of all the responsibilities, I think. And when you're younger, you're able to handle most of these challenges better.
Okay, that's all. There are 2 new questions. Let me check them. Is there a break between moving from 1 year to the next?
No, there's no break as far as ours is concerned. You just finish exams, and then once the results are out, you continue to the next year. So there's no break per se.
Someone has asked a heavy question. I don't know that it is the weight of losing patients as an OBGYN and the medical legal side of it. Well, what do you think of that, Doc?
Yeah, it's quite heavy. And I usually say that maternal mortality hits different. Unlike any other mortality. I know no mortality is good, but maternal mortality really hits different. But with the mentorship and knowing that you're not alone, because you being the first on call, you have consultants who are second on call, and they are very accessible and they are always there to help. And by the time you're maybe losing a patient, then you know that you've done the best, you've given the best that you could. So yeah, but the medical legal side of it, yeah, it's there. But I think as long as you've done your best and you've documented well and there is no negligence, then I think you'll be fine. But yeah, it does hit different.
All right. Any other? Let me see. There's one more. No. Are there male residents in OBS and Paeds? Yes.
Yes,
There are male.
very many.
It's just that for some reason, it's just that there is the administrative responsibility, and for some reason, in the last couple of years, has been taken by our female colleagues. And Doc, is that something that is happening in your department as well? As we've had more the fairer sex taking more responsibility in terms of chief regs and deputy chief regs.
I mentioned that I'm the deputy chief reg.
Yes, yeah, chief
My
reg
chief reg is
yes,
male. Yeah, Dr. Muti
yes,
and Isaiah, but couldn't be here, so
yes.
I'm here on his behalf.
All right. So guys, there's no we have both male and female residents. Yes. Someone is asking so as you wait for results, you actually have a break. In IMED,
So
no,
it differs. Last year we had a study break and we had a small break. But other than that, you'll continue being on the rota as you wait. Because even if maybe you need to retake the exam, you'll still be in that year that you're supposed to be in. So you'll still be on the rota, basically. I don't know about the other disciplines.
yeah, it's the same for us. You'll still be in the rota as long as the results come out. You might in some places you might proceed to the next year as you wait for the results. Someone is asking, how many hours a week does the OBSCAN resident work in UIN?
So the department requires 40 to 45 hours per week. But you see, it might differ depending on which block you're in, because some blocks will have heavier and longer shifts than others. Yeah, but 40 to 45 hours is the requirement.
The next question is, how many residents are you in your class or in every year?
So the intake
cohort?
is usually 30 to 35, but there are years when they've been less. Like my class, we were the smallest class because that is the year that the fee had been adjusted from the previous around 180 to the current fee that we have. So we were a smaller class of 20. And given the duties that are there, like 20 might sound like it's a big number, but it's actually a small number. As I said, you have 2 theaters, maternity theaters, just doing CSs running concurrently. And during Nairobi County strikes, we even have 3 theaters. So in 24 hours, those are 6 residents. In labor ward, you need 2 residents, one covering the acute, like the very sick patients, eclampsia, preeclampsia, and one that is sorting out the labor and the other non-complicated issues. So you have 2 in the ward at a given time. So in a day, that is 4. So already labor ward alone can have up to 10 registrars in 24 hours. You haven't touched the wards, the clinics, the theaters, casualty, that K24 we talked about. So yeah, it's around 30. That's the intake per year.
The next one is for the yes, that is really clear. It's a compact program requires more hands on board. For the year 2 electives, do you choose hospital or where are you placed?
You choose the hospital. You do choose the hospital. So if you worked in the county, you can go back to the county. You can attach yourself to someone. As long as at the end of the 2 years, you bring your logbook, you've rotated in all those departments.
Okay, let me see. Okay, so Doc, I've seen you have these webinars of work-life balance. You have this, it's an obstetric, usually obstetrics department directed. So the question is work-study balance in case somebody has kids. How is that for MEd?
So for MEd, I think my colleagues will also contribute to this. But so for our department, if someone has maybe very small children or they are still breastfeeding, this is just sort of a, not to say local arrangement, but just the understanding, because the rotas are made by the chief residents and then approved by the department. So we understand that people have other things to do. So for example, people who are breastfeeding or they're just from maternity leave, then we start them off with a lighter block, like maybe the specials block. When they are still breastfeeding, we accommodate them to do day shifts as opposed to night shifts. So I think it's just trying to balance and accommodate each other. And when there is an issue, you can always reach out, and then the department will be of help.
All right. Thank you so much for that. Any other questions, guys? You can post in the chat or you can unmute yourself. Let me stop sharing. Looks like we don't have any other question. So guys, thank you so much, Dr. Karen, for this great presentation, for coming through, despite the heavy rains last night and power outage. You've represented the program very well, and I think people have the understanding now of how the obstetric department is run, and we appreciate you coming through and giving us this mentorship talk.
Thank you for having me as well.
And also to all the presenters who've been here today and who've taken us to the different programs in the two oldest medical schools in Kenya. We thank them, and we thank them for their time and for their mentorship and during this session. So in terms of announcement, so next week we have, on Saturday, we have the surgical program, and that is we have general surgery, orthopedics, and the others such as cardiothoracic surgery, neurosurgery, plastic surgery, pediatric surgery. And that will be both by chief regs from MOI and UN. In some places, MOI may not have some of the programs, but we'll only present from UN. And then on the third week, we will have specials, that is ENT, which is also a surgical program, but we didn't want to congest today. And we will have also ophthalmology, dermatology, and radiology, and maybe psychiatry, if people might be interested in psychiatry as well. Then I see some questions that are coming up. Maybe I'll try to reach out to my colleagues who are in the collegiate system, and we'll have a webinar on the collegiate system. There are 4 collegiate systems that are currently working. That is COFEXA, EXACOP, which is for physicians, CANEXA, which is for anesthesiology, which will also be in the specials, and come and help us and talk about those programs. And finally, we had an issue with our stream today, which we'll work on it. So next week, we will stream this to our colleagues who are not able to join in the main meeting. So kindly go to our YouTube, which I'll share right now, and subscribe so that you are able to stream. And also our website, like I told you earlier, is available for all of us who want to practice and for the exams that are coming up. We share the invitation. This is our YouTube channel. Kindly subscribe and so that you're able to stream next time. And then, if you also want to, we're not able to get Doc on board, and for the Paeds presentation for Nairobi for UON, so we'll try to reschedule it and see when it will be available. Because of the power outage issues, he was not able to join us. So we'll check whether we can reach out to him again and see whether he will be able to do it again. So with that, I would like to also, this is the WhatsApp channel for people who are interested in the entry exams and so on. So the reason why I did not include Aga Khan is that Aga Khan has already advertised for the exams, and I'm not sure whether they have done it. So people have been actually, so that process is already started. That's why I did not include them. And I thought maybe that is already passed. To be honest, maybe we'll include it next time. Yes, I'm thinking about it. We're thinking about it. Anesthesiology, yes, it's part of specials. Will include anesthesiology and critical care, and in the third week of May, so that that is a wholesome mentorship program. Will you please share a link for the exams, including the plabs. With plabs is different. So I mean, what we're talking about today is entry exams, and that's what we have for you. And you can join the WhatsApp channel and WhatsApp group, and then we tell you more about it within the weekend, so that you guys can start preparing for your exams. Where can we get the recording for this meeting? We will post it on our YouTube channel so that we go ahead. You guys can watch it there. So I can see there's one person interested in psychiatry. Yes, since there's that, we include psychiatry as well. But in the specials that can come out. Any other special requests that you guys have, you can post it so that you take it into consideration. Okay, looks like radiology is part of the specials. So radiology, anesthesiology, and ophthalmology, ENT, and now we have psychiatry. So I think five is good enough, so that you don't have to crowd a presentation. Yeah, I forgot about dermatology. Yes, dermatology is also part of it. Dermatology is offered by JQuat, so we'll bring someone from there. Okay. I think we have it. You guys are pushing it now, non-clinical. All right, sawa. Let's finish this clinical part, then we can look at non-clinical. The non-clinical pathways that are coming up, and maybe we can put that as a webinar as well. Sawa, good thought. we'll look at it. Any other areas? All right. So with that, I would like to thank all of you for attending this session. We'll see you same time next week, same place. We'll reshare the links. We'll work on our YouTube stream. There was a slight technical issue, and so that more of you can join and listen to us. And we would like to again thank all our presenters here today who've been really projected the department very well. And we thank them for their time, and we thank them for the presentations as well. So with that, we'd like to tell you a good day, and thank you, Doc, as well. And we'll see you next week.